So hello people, today we are going to learn about ALL, AML, CML and CLL. So basically you should know what is ALL, AML, CML and CLL. You should know the difference between how you are going to diagnose each of this. So basically according to WHO, if in the bone marrow more than 20% of blast cells are present, that is known as acute case. That can be AML, that can be ALL. If less than 20% of blast cells are there, that is CLL or CML. So now you should know the definitions of ALL, AML and all of this. So these are the definitions. AML means acute myeloblast leukemia. ALL means acute lymphoblast leukemia. CML is chronic myeloid leukemia. CLL is chronic lymphocytic leukemia. So basically this lymphoblast can also be known as, this myeloblast can also be known as myeloid leukemia. But for your making it easy for you people, I am saying that take it as myeloblast. Okay, like we can call it myeloid also. Like in some books it is referred that as, like commonly we call it as acute myeloid leukemia. But so that it will be, your understanding will be easy, I am telling you, take it as acute myeloblast leukemia. So now what happens is, you should know this, like how these cells are generated and everything you should know. Then you can differentiate each of these very well. So basically, one pluripotent cell will be there that will lead to myeloid stem cells, lymphoid stem cells. Fine. Lymphoid stem cells will lead to lymphoblasts. Myeloid stem cells leads to RBCs, platelets, WBC. So many cells will be there. Fine. So as I told you, if acute myeloblast leukemia means it's cancer. Fine. So if a patient is having AML, AML means acute myeloblast leukemia. I told you myeloblast. So this is the cancer of myeloblast. So myeloblast will be increased. Fine. I told you in AML, more than 20% of blast cells are there. So if more than 20% of myeloblast is there, that is the case of AML in the bone marrow. Fine. So in the patient, if somebody is having AML, what happens in that person is blast cells are increased, right? So if blast cells are increased, that means they are not going to mature to WBC. So WBCs are reduced if a patient is having AML. So WBC reduced. Fine. Then, so now this myeloblasts are too much in the bone marrow that it is not letting erythroblast or megakaryoblast to mature. So that means in AML patient, RBC will also be reduced. That means the patient is having anemia. And then platelets that are also reduced. So all of these things will be reduced in the case of AML. That is known as pancytopenia. Fine. So this was the case of AML. Now if like more than 20%, I told you that more than 20% blast cells should be present. And that can be myeloblast. If it is myeloblast, then that is the case of AML. If it is lymphoblast, then it is the case of ALL. If blast cells are there. Fine. So if lymphoblasts, like too many lymphoblasts are there, that means lymphocytes will be reduced. Lymphoblast is not getting mature to lymphocytes. Fine. So lymphoblasts are too much. So that will lead to blast cells are more than 20% blast cell. That is lymphoblast. Fine. In the bone marrow. And then what happens? Too many lymphoblasts are there. It is not letting any of this to get mature. So same, like RBC will be reduced. Platelets will be reduced. Only excessive thing is lymphoblasts. Lymphoblasts will be too much. This will be high. Fine. Done with AML, ALL and all that. Now let's come to CML. I told you if myeloid cells are high, not blast cells. Blast cells are not at all high in chronic myeloid leukemia. I told you this, less than 20%. Blast cells are not high. That is chronic case, CLL or CML. Fine. If it is CML, chronic myeloid leukemia, what happens is, I told you myeloid leukemia. So basically what happens here is myeloid stem cells are increased. Fine. That will lead to increase in all of this. So WBCs will be high. Platelets are high. RBCs are like, you know, maybe high. It's like, or normal. The hemoglobin is not that, or maybe like, you know, reduced only. Like it's not too much high in these cases. Fine. Or it's not too much less also. It's almost neutral type of thing. If it is the case of CLL, that means lymphoid cells are too much. Fine. If lymphoid cells are too much in my bone marrow, what will happen? There won't be any problem with myeloid cells and all. Platelets will be normal, RBC will be everything fine. That will lead to lymphocytosis. That means too many lymphocytes are there. Fine. So TLC will be increased. I hope so you got the difference between each of this. So now let's see some of the differentiating features. So I have this as my notes and all. So you can see in this what happens in each of this. So this is the case of CLL, chronic lymphocytic leukemia. Fine. It usually happens in old age. What will happen? Generalized lymphadenopathy will be there in these patients. RBC, normocytic normochromic anemia. WBC will be lymphocytosis will be there. Platelet will be normal. So if these things, HBC will, hemoglobin will be less, TLC will be increased, and lymphocytosis will be there. So this is the case of CLL. Now let's come to CML. What happens in CML is chronic myelogenous leukemia. Fine. Philadelphia chromosome is the reason for that. Excessive abdominal pain, like massive splenomegaly is the one of the most important feature of this, because so many, like I told you, so many myeloid cells will lead to so many RBC, so many thrombocytosis, platelets, so many WBC that will lead to that they will, like, see, spleen is the graveyard of all the cells, right? So all these cells will go and die in the spleen. So many cells are generating, so many cells are dying in the spleen. So massive splenomegaly is one of the feature of CML. Fine. And the platelets, wherever you see any thrombocytosis, that is the case of CML only. Then let's come to ALL. ALL, I told you, blast cells are increased. Lymphadenopathy will be there, and if you see that if a child is coming with all these features, like ALL is the most specific feature of children. Fine. 1 to 5 year of age, if somebody, like in the clinical scenario, if it is given that the child is coming who is 5-year-old with the pallor is there, like hemoglobin is less, WBC is reduced, platelets reduced, that can be the most important, that can be the case of ALL. Fine. Bone marrow, you will see so many lymphoblast. I told you, ALL, lymphoblast leukemia. Fine. This you have to remember, blast. Okay, so AML, ALL, blast cells will be increased, CML, CLL, myeloid, lymphocytic, like all these cells will be increased. Then let's come to AML, that is any age group it can happen. And then most probably HB, WBC, platelets will be reduced in that. Obviously, I told you this is myeloblast. So blast cells lead to, myeloblast leads to RBC, WBC, all those cells, right? So everything will be reduced in this. Fine. Then bleeding disorders can be there. Hepatosplenomegaly is common in all of this. Fine. So basically, this is the overview of like AML, CML, and all of this. I hope you understood. This is just to make it easy for you. You, like most of the book, write it acute myeloid leukemia as well, but it is also known as myeloblast leukemia. So I hope it's easy now for all of you, and notes will be attached in the description so you can download from there. So thank you.